Hi everyone, I am BHAVYA. Today I am going to perform blood pressure measurement. The required devices for blood measurement is sphygmomanometer and stethoscope. You have to sanitize yourself or wash your hands before approach patient. Introduce yourself to the patient and collect details about the patient and also past medical history and present illness. Patient should not intake of caffeine or smoking before 30 minutes. Patient should sit in straight position and do not cross his or her legs. Make sure patient should feel comfort while performing. Ask the patient to place the hand on the top of the table. Attach the cuff to the patient hand. To estimate the approximate systolic pressure, palpate radial artery and inflate the cuff until you no longer feel the pulse. Note the reading when the pulse is disappeared. Palpate brachial artery and place stethoscope. Inflate the cuff above the approximate systolic blood pressure. Slowly deflect the cuff and listen for the first choreographic sound. And also note the last choreographic sound. Your first choreographic sound is systolic pressure and last choreographic sound is diastolic pressure. Remove the cuff from the patient hand. Normal and hyper blood pressure readings.
Before we start, we'll just sanitize our hands. Hi, my name is Dr. SANJAY JAISWAL and I'm a second year medical student. Today we'll be performing an ear examination for you. Before we start, may I know your name?
My name is Sanjay Jaiswal.
And your date of birth?
29th of February 2000.
Today we'll be performing an ear examination using an otoscope and tuning fork. For that, I'll be using the otoscope to look inside your ear and see how all of your membranes and how it is. Yes? Is that okay with you?
Yes.
And during any of the procedures, if you feel any pain or any kind of discomfort, please do let me know. Okay, now we'll be doing a whispering test, for which I'll be using my hands to cover up one of your ears, and I'll be whispering the number on this side, and you let me know which number it is. Yes?
69, 33, 45, 98.
Now I'll be doing the same thing on the other side.
39, 84, 96, 11.
Okay. For this test, it's called Vickers test. For that, I'll be using the tuning fork, and I'll be putting it in the middle of your forehead, and I want you to let me know which ear you feel the sound the lightest or any louder. Yes? Okay, or is it equal on the both sides?
It's equal on the both sides.
Okay, that's good. Now we'll be performing a RANI test, for which I'll be using the same tuning fork, and I'll be placing it right behind your ear. Okay, I want you to let me know if you can hear it on that ear and when it drops. Yes? Can you hear it?
Now it stopped.
Okay. Can you hear it?
Yes.
Let me know when it drops.
Now it stopped.
And I will be doing the same on the other side.
Now it stopped.
Can you hear it?
Now it stopped.
Can you hear it?
Let me know when it stops. Now it stopped.
Now I'm just checking out your outer ear part. If there is any pain or anything that you maybe have been feeling before. Is there any pain you feel?
No.
All good?
Yes.
all good. The muscles are good. Not any redness or swelling or any kind of redness, rashes or anything. I'll just check out the other side. Is there any pain on the area? Same with this side. There isn't any redness or any hardening. All look good. Now we'll be performing a medical study with these two. Okay, they are all steroid. Now we'll leave it one. For this, I'll be inserting it inside your ear. And if there is any pain or anything that you feel, do let me know. Yes. Thank you. I think that's it. It's not clear. There isn't any redness or things like that. Okay, and I'll be checking out the other side as well. It all looks good. There isn't any redness or anything like that. Okay, now we have finished our ear examination test. This is just a normal ear examination. And before we finish, we'll just sanitize our hands.
Washing hands.
Hello, my name is SOWJANYA. I am studying second year. Can I just check your details, please? What is your name?
My name is Zita.
What's your age?
7.
Okay, today I am going to examine your motor testing of upper extremities. Is that okay for you?
Okay.
Okay. I am going to place this cotton wool on your face. If you feel any sensation, could you please say yes?
Okay.
Okay. Can you close your eyes? Do you feel anything?
Yes. 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 Yes.
Okay. And now I am going to place a sharp object. If you feel any sensation, can you please say yes?
Yes. 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 Yes.
Okay. Yes. Okay. Now can you please bite your teeth? Okay. Can you please look up and raise your eyebrows? Okay. Now will you close your eyes tightly? Okay. Could you please show your teeth? Smile. Okay. Relax. Now I'm going to examine your hearing. Okay?
Okay.
Okay, now I'm going to close your one ear and I'm going to whisper some words. Could you please repeat?
Yes. $55. $89.
Okay, now I'm going to do this here.
Let 32.
56.
56.
Okay. Okay, now I'm going to perform another test with this tuning fork. Okay?
Okay.
Tell me when the buzzing sound is off.
Yes. Stops.
Do you hear anything?
Yes.
Okay, now I'm going to place this tuning fork here. Can you tell me if you hear this in your ear or in the middle?
Middle.
Okay. Give me a hand. Okay, could you please place your hands like this? Okay, now I'm going to use my paws, try to resist it. Okay. Hands like that. Okay, now I'm going to use my hand. Could you please place your hands like this? So I'm going to use my paws, try to resist it. Okay. Place your arm like this. To both arms. Okay, I'm going to use my
Start.
Do like this. That completes the procedure. Thank you.
Good day, doc. This is CHENNUPALLI RANI. So today I am going to perform cerebellum and sensory test. To perform this test, patient should be in sitting position. Examiner holds his index finger at arm length from the patient. Patient asked to touch the finger and his nose. This should perform slowly and repeatedly. Patient should make rapid alternative movements by patting his knees with palm and the back of his hands by pronation and supination. If failure to do, there is a cerebellar dysfunction. The patient slides the heel down the anterior tibial surface of the other. There should be a smooth movement and the heel should remain on the shin. Ask the patient to walk across the examination room and observe for the posture and balance and swinging of the arms. To perform this test, patient with open eyes asked to walk naturally and in tandem fashion, that is heel to toe. And ask to patient to walk on toes. And walk on heels. Performing hop in place test. Performing shallow knee bend. Ask the patient to stand with feet together and arms to the side. Stand at the side of the patient and extend your arms in front and one behind the patient. Ask patient to close his eyes. Patient should maintain posture without movement of feet with closed eyes. So it's negative. If patient can't maintain, observe with open eyes. Note patient's ability to feel touch of a wisp of cotton. Following a similar procedure, alternatively, use dull and sharp part of a safety pin. To perform this test, place a vibrating tuning fork over the bony prominences, shoulder, elbow, wrist, iliac crest, knee, ankle, spine. Note the ability to feel the vibration. For this test, by the examiner, the fingers and toes are moved passively and patient is asked to indicate the position and should hold the finger and toe at other sides. To perform this test, simultaneously touch the various parts of the body with two ends of a unfolded paper clip. Ask the patient if 1 or 2 points are touching him. To perform this test, ask the patient to spot the point where he was touched. Ask the patient to identify letters or numbers written on his palms or other parts of the body with a blunt point. Using your index finger, simultaneously touch the both sides of identical areas in the body. Ask the patient to tell if he touched has been one or both sides.
Eye examination. Let us start with visual acuity. Ask the patient to stand 20 feet distance from Sneller's chart and close one eye and read the chart. Remember to ask the patient to wear his glasses or contact lens if he is using them, but ask them to remove reading glasses as they blur the distance vision. Repeat the same with the other eye. Record the visual acuity using two numbers such as 20 by 20, which is normal. Now, test the patient's visual fields. Directly face the patient from a comfortable distance. Ask the patient to close one eye, look into your eyes. Place your hand 2 feet apart lateral to the patient's ear level and move your wiggling fingers along imaginary line until he points to them. Repeat the same with the other eye. Now, repeat the process with both sides together. Normal patient sees both fingers at same time. If so, both visual fields are normal. Now, eye inspection. Observe the alignment and symmetry of eyes. Also, examine the eyebrows closely. Inspect the eyelids. Inspect the area over the lacrimal gland and lacrimal sac for swelling. Inspect the conjunctiva and sclera by asking the patient to look up. Pupillary responses. With oblique lightening, inspect each cornea and lens for opacities. Continue assessing the pupils by checking their reaction to light in dark room. Now, assess the extraocular muscle shine. Extraocular movements. Now, check the 6 cardinal directions of gaze. From 2 to 3 feet distance from the patient, ask the patient to follow your finger, making a wide hedge in air without pausing. Eye movement should be symmetrical and conjugate. Now, test the convergence of eyes. Observe as the patient's eyes watch your finger or pen tip move towards the bridge of the nose. Normally, eyes converge. Thank you.
Test the sense of smell by presenting the patient with familiar, non-imitating odors. First, make sure that each nasal passage is patient by compressing one side of the nose and asking the patient to sniff through another. Then ask the patient to close both eyes, occlude the nostril and test the smell in another with substance like close. To test visual acuity, inspect the optic fundi with your ophthalmoscope, paying physical attention to optic disc. Test the physical fields by confirmation. Test each eye separately and both eyes together, occasionally in stroke patients. For example, patients will complain of partial loss of vision and testing of both eyes reveals a visual fluid defect. Abnormal in peripheral vision such as homogeneous hemoptysia. Inspect the size and shape of the pupils and compare one side with the other. Anisotropia are a difference of less than 0.4 millimeters in the diameter of the pupil compared to another is seen in up to 38% of healthy individuals. Test the pupillary reactions to light. Test the extraocular movements in the 6 cardinal directions of gaze and look for loss of conjugate movements in any of the 6 directions which cause diplopia. Observe the patient body position during the movement and rest. Abnormal position alerts the conditions such as mono or hemiplegia. Inspect the size and contour of the muzzle. Do the muzzle look flat or concave? When a normal muscle with intact nerve supply is relaxed voluntarily, it maintains a residual transition is known as muscle tone. Normal strength varies widely, induces defects of age, sex, and muscular training. To test flexion at the hip, by placing your hand on the patient's mid-thigh and asking the patient to raise the leg against your hand. To test adduction at the hips, place your hands firmly on the bed between the patient's knees. Ask the patient to bring both legs together. To test abduction at the hips, place your hands firmly outside the patient's knees. Ask the patient to spread both legs against your hands. To test extension at the hip, have the patient push the mid-posterior thigh down against your hand. To test extension at the knee, support the knee in a flexion and ask the patient to straighten the leg against your hand. The quadriceps is the strongest muscle in the body, so expect a forceful response. To test flexion at the knee, tell the patient to keep the foot down as you are try to straighten the leg. To test foot dorsiflexion and plantar flexion at the angle by asking the patient to pull up and pull down against your hand.
Notify the top level of venous pulsation, illuminating the right side of neck oblique with the pen light. Place ruler 1 and ruler 2 vertical horizontal from the sternal angle. Move ruler 2 up down in horizontal position so that the lower end rests at the jugular distance. Vertical distance of ruler 1 JVP and add 5 cm to the CVP. Carotid pulsation seen medial to the higher than the base of sternocleidomastoid muscle. Do not palpate simultaneously. Observe, locate the apex beat by shine penlight tangentially on the precordium. Note amplitude and rhythm by placing finger pad of second and third digits over the visualized apex beat. If not visualized, palpate by laying the palmar aspect of right hand. If not, palpate with the patient supine. Palpate in the left precipitous position. Apex beat palpable only in 50% of adults. Using CS and LMCL determine the exact location of the beat, apex beat from the sternal line to X mark of the apex. Your right hand over the left sternal border with the finger over apex occur with the ventricular hypertrophy due to pressure over. Palpate the heart sounds at the base aortic, pyonic and apex for feel of A2, P2 and S. By the palmar base of your finger over all the vascular areas of intercostal parallel to the ribs to feel the thrills. All the aortic, then pulmonic down the left sternal border and finally the apex and into the mid-axillary, left mid-axillary. Describe the thrills, systolic or diastolic. Count the heart rate and identify the rhythm, placing bell or diaphragm of the stethoscope on the apex and low the rate per the minute. Identify the first and second heartbeat by placing diaphragm on the base and apex vice versa. Describe the intensity of S1, S2 sounds. Notify splitting of S1, S2 with the diaphragm over the pulmonary wall area. Ask the patient to take long breath. Listen for the splitting of S2. Listen S3 and S4. Place the bell lightly over the apex and listen. Ask the patient to sit. Lean left side laterally decipitous. Start from base over aortic wall region, inch down pulmonic valve area, then down to the tricuspid wall, then laterally to the mitral valve area. If murmur is heard over mitral valve area, listen for the radiation by inching the stethoscope laterally superiorly towards the mid-axillary line and posterior axillary line and inferior scapular area. Murmurs heard over the aortic area, listen through radiation over carotid arteries. Listen through the several respiratory cycles.
I am Gunasekaran CHENBAGA. Now I am going to do the shoulder examination. I will start with inspection. First, inspect the shoulder and shoulder girdles, clavicle and scapula for any abnormalities or tenderness. Next, palpation. Palpate the joints, bones and muscles for tenderness. At the sternoclavicular joint, trace the clavicle laterally. Next, bony spine of the scapula laterally and upward until the acromion reaches. At the distal end of the clavicle, palpate the acromion clavicular joint and down medially, coracoid process. And next, palpate the greater tubercle of the humerus. Next, I will be doing the range of motion. Forward flexion, raise arms forward and straight up over the head. Next, hyperextension, extend and stretch the arms behind the back. Abduction, lift the arm laterally. Adduction, cross the arm in front of the body. Internal rotation, place the back of the hands behind the hips with elbow out. External rotation, raise the arm to shoulder level and bend the elbow and rotate the forearm toward the ceiling. Next, for the crossover test, attack the patient's arm across the chest. Next, for the apply scratch test, ask the patient to touch the opposite scapula using the two motions. Next, for the knee impingement test, press on the scapula with one hand and raise the patient's arm with the other hand. For Hawking impingement test, flex the patient's shoulder and elbow to 90 degrees and then rotate the arm internally. For the drop arm sign, ask the patient to fully abduct the arm to shoulder level and lower it slowly. For the empty can test, elevate the arm to 90 degrees with internally rotation and ask the patient to resist as you place downwards pressure on the arms. Next, I will be doing the infraspinatus test. For the wrist examination, inspect the palmar and dorsal surface of the wrist for any deformities or any tenderness or any abnormalities. Next, palpate the radiocarpal joint and metacarpophalangeal joint and interphalangeal joints. Next, for the range of motion, flexion, extension, abduction, adduction. Next, for hand grip strength, ask the patient to grasp your hand as he can. Next, by Finkelstein test, I will test the thumb function. For carpal tunnel syndrome, first thumb abduction. Test tinal sign for medial nerve compression by tapping lightly over the course of the median nerve in the carpal tunnel. Test Fallon sign for medial nerve compression by asking the patient to hold the wrist in flexion for 60 seconds. Thank you. I am done with the examination.
My name is KANAPARTHI DEDEEPYA. I am doing abdominal examination on Rajaratnam. Before doing examination, first sanitize your hands. In general inspection, the symmetry is flat and the umbilicus is inverted. Inspect the person from lateral side as well as from leg side. Second, we are going to do the oscillation with the help of the stethoscope. I want to hear the bubble sounds with the help of the stethoscope, and we can hear a bubble sound from 2 to 10 seconds. If we don't hear any bubble sound between 2 minutes, then we are hearing a silent bubble sound. I also want to see is there any abdominal aneurysm. So I am going to oscillate near to the abdominal. We are going to perform percussion. So what actually I want to access while doing percussion? If I have to check whether there is hepatomegaly or splenomegaly or there is any free fluid present in the peritoneal area, and I also want to check shifting of dullness. So on the basis of tympanic sound and dull sound, I can differentiate. I want to check the level of the free fluid in the body. So first of all, I want to practice over the bladder, and after that I will be moving towards the right. Ask the patient to turn lateral so that we can check for the fluid. Now we are going to do palpation. First we have to do superficial palpation. Later we have to do deep palpation. While doing palpation, we have to look at the patient while palpating the 9 segments. Suppose if patient is complaining that he or she is having a pain in a particular segment, are you going to palpate that area first or at last? Always remember that we have to palpate that area at last. Going to palpate the liver. To palpate the liver, always start from the lower part, right lower quadrant, and go up. Now I am going to palpate the spleen. For palpating the spleen, we have to move from the right lower quadrant to the left upper quadrant. Now I am going to palpate the kidney. For palpating the kidney, we have to use both hands. Going to do head raise test to palpate supraumbilical segments. Now we are going to do leg raise test to palpate infraumbilical segments. Press the tip of the fingers deeply slightly perpendicular to the abdomen and suddenly withdraw your finger. Ask the patient to flex the thigh against resistance. Flex the patient's hip and knee at right angles. Internally rotate the hip. This will stretch the internal obturator.
I'm Mohan Reddy, Durgempudi. Now I'm going to do your lung examination. For that we have to remove your shirt. Is that okay for you? Okay. Okay, now I'm going to closely examine your lungs.
Stop.
Okay, now I'm going to palpate your lungs. Okay, let me know if you have any pain.
No.
Now I would like to examine your chest expansion. For that I have to tightly hold your back. Breathe in, out, in, out, in. Okay, now I would like to percuss your posterior chest wall. For that, keep your hands fold. Okay, now I would like to oscillate your posterior chest wall. Put your hands forward. Okay, take a deep breath and out when I put my diaphragm with your mouth little open. Okay, now I'm going to oscillate. Okay, thank you. Okay, now I'm going to oscillate with the diaphragm. When I feel the diaphragm, just repeat the number what is it. Okay? 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99. 99. Okay, after oscillating your posterior chest wall, there is no adventitious sound in that. Okay, after oscillating your posterior chest wall, I didn't find any adventitious sound. Okay, this is your examination. Thank you.
This video shows how to examine the neck. The examiner has already washed his hands, introduced himself, explained the procedure and obtained the patient's consent. He has also asked if the patient has any pain anywhere and obtained adequate exposure of the neck. Start by inspecting the neck from all angles, looking for scars, obvious lumps and any skin changes.
Could you please take a sip of water and hold it in your mouth? And now could you swallow it, please?
As the patient swallows, look for a thyroid mass, which will move on swallowing.
Thanks very much. Could you open up your mouth and stick your tongue out?
As the patient sticks their tongue out, look for a thyroglossal cyst, which is a midline lump that will move upwards on tongue protrusion.
And place your tongue away and stick your tongue out.
Get the patient to open their mouth before sticking their tongue out, as jaw movement can also cause movement of neck structures.
Very good. Thank you very much.
Next, palpate the neck from behind, having warned the patient what you're about to do. Palpate all 6 levels of lymph nodes in the neck. Start at level 1, which is the submental and submandibular lymph nodes, and also feel for the submandibular gland. Next, feel the level 2 lymph nodes, which are the upper jugular nodes. Then the level 3 lymph nodes of the middle third of the jugular, moving on to the level 4 nodes of the lower jugular. Palpate the posterior triangle of the neck, which is level 5. Then palpate the central area of the neck, which is level 6.
Could you take a mouthful of water and hold it in your mouth, please? If you could now swallow.
Feel for any thyroid masses which will move on swallowing.
Thank you very much.
Remember to palpate the postauricular and preauricular lymph nodes.
This video covers the examination of the mouth. The examiner has already washed his hands, introduced himself to the patient and obtained their consent. Examination of the oral cavity requires a headlight and 2 metal tongue depressors.
Please open your mouth.
The mouth is open widely and inspection of the oral cavity begins.
Please open your mouth nice and wide.
You look at the upper teeth and the lower teeth, and the buccal sulci on each side are examined. The patient is asked to stick their tongue out to one side.
Hook it over to the left.
To allow you to inspect the lateral part of the tongue for tumours or any other abnormalities. Then the opposite side is examined.
Tongue back in the mouth, and now touch it to the left cheek.
It is important to specifically examine the retromolar trigone more posteriorly.
Very good. Lift up your chin, please, and open your mouth really wide.
The tongue is then depressed to visualise the hard and soft palates and the posterior pharyngeal wall. The patient is asked to say symmetrical palatal elevation. Finally, the patient is asked to raise their tongue to the roof of their mouth, so the underside of the tongue can be examined, along with the floor of the mouth. Moving on to palpation, the gloved finger can be used to feel for abnormalities within the tongue itself. Then a finger placed intraorally can be used to feel for the submandibular ducts, the sublingual glands, and to allow for bimanual palpation of the submandibular glands. The parotid can also be bimanually palpated, and saliva can be expressed through the parotid duct opening, seen here. This concludes the examination of the mouth and the oral cavity.